Assalamu alaikum everyone. Now let's start today's workshop. First of all, I would like to warmly welcome each and every one of you to join this PMC certified workshop on Proprioceptive Neuromuscular Facilitation PNF techniques. I am Dr. Mariam Tahir, Director and CEO of PMC Professionals Hub and HCPC UK registered physiotherapist, and it is my pleasure to be your instructor for today's session. Today we are going to learn one of the most effective and widely used rehabilitation approaches in physiotherapy, that is PNF techniques. You should know that PNF is not just a stretching method. It is a comprehensive therapeutic approach that helps improve flexibility, muscle strength, coordination, balance, neuromuscular control, and functional movement. Because of these benefits, PNF is commonly used in neurological rehabilitation, musculoskeletal conditions, sports physiotherapy, and post-operative rehabilitation. During this workshop, we will start with the basic concept of PNF, understand its neurophysiological principles, learn the different movement patterns and treatment techniques, and finally discuss how to apply these techniques safely and effectively in clinical practice. My goal today is not only to explain the theory, but also to help you understand why, when, and how PNF techniques should be used to achieve the best outcomes for your patients. I encourage everyone to stay engaged throughout the session. If you have any questions, please note them down and we will discuss them during the question answer session at the end. Okay, let's begin our journey into PNF techniques. Now let's move to our learning objectives. Before we start discussing PNF techniques in detail, it's important to understand what we want to achieve by the end of today's workshop. You should know that having clear learning objectives helps us stay focused and understand exactly what knowledge and skills we are expected to gain. By the end of this session, you should be able to define proprioceptive neuromuscular facilitation or PNF and explain its basic principles. We will also understand the neurophysiological basis of PNF, which means we will learn how our nervous system and muscles work together to produce movement and how PNF enhances this process. Next, we will discuss the clinical indications and contraindications. In other words, when should we use PNF and when should we avoid it? Patient safety is always our first priority. After that, we will explore the different PNF movement patterns, including the upper limb and lower limb, diagonal patterns, and understand why these functional movements are more effective than isolated muscle exercises. We will also learn the most commonly used PNF techniques such as hold relax, contract relax, rhythmic initiation, slow reversal, rhythmic stabilization, and repeated contractions, also with their clinical application. Okay, another important objective is to understand how PNF can be applied in different rehabilitation settings, including neurological rehabilitation, musculoskeletal conditions, sports injuries, post-operative rehabilitation, and balance training. Finally, we will discuss how to apply PNF safely and effectively in clinical practice using proper patient assessment, correct therapist body mechanics, appropriate resistance, and evidence-based decision making. Okay, these are the goals we aim to achieve today. If you follow the session from beginning to end, you will have a solid foundation in PNF techniques that you can apply confidently in your clinical practice. Okay. Now let's move to the next slide and begin by understanding what PNF actually is. Now let's move to the most important question: what is PNF? Before we learn the techniques, you should first understand what PNF actually means. PNF stands for Proprioceptive Neuromuscular Facilitation. Let's break this term into three parts. Proprioceptive refers to the sensory receptors in our muscles, tendons, and joints that tell the brain about the body's position and movement. Neuromuscular means the communication between the nervous system and the muscles. The communication allows our muscles to contract, relax, and produce smooth, coordinated movements. Finally, facilitation. Facilitation means making movement easier, more efficient, and more effective. So, when we put these three terms together, PNF is a therapeutic rehabilitation approach that uses specific movement patterns, manual resistance, stretching, verbal commands, and visual cues to improve movement and function. You should know that PNF is not simply a stretching technique. Many people think PNF is only used to increase flexibility, but that's only one part of it. In fact, PNF is a comprehensive treatment approach that helps improve muscle strength, flexibility, coordination, balance, stability, neuromuscular control, functional movement. Okay, one of the unique features of PNF is that it focuses on functional, diagonal, and spiral movement patterns rather than isolated muscle actions. Okay, think about everyday activities like reaching for a seat belt, combing your hairs, climbing stairs, walking, lifting an object, or kicking a ball. These movements don't occur in just one plane. Instead, they combine movements in multiple directions. That exactly how PNF trains the body. Okay. Another important point is that PNF treats movements, not just individual muscles. Instead of strengthening one muscle in isolation, it trains groups of muscles to work together, just as they do during daily activities. Because of this functional approach, PNF is widely used in neurological rehabilitation such as stroke and Parkinson's disease. Secondly, orthopedic rehabilitation after injuries or surgery, and sports rehabilitation to improve performance and prevent injuries. And it also using geriatric rehabilitation for balance and mobility. And at last, general musculoskeletal physiotherapy. Okay, research has also shown that PNF can improve range of motion, muscle strength, coordination, balance, gait, and overall functional independence when applied correctly. So, okay, now that we understand what PNF is and why it is such an important rehabilitation approach, let's move to the next slide and learn about the history and fundamental principles behind PNF. Now let's move to the history and principles of PNF. Before applying any treatment technique, you should know where it came from and the scientific principles behind it. Understanding this foundation of PNF will help you use it more effectively in clinical practice. Let's start with the history. PNF was developed in the 1940s and 1950s by Dr. Herman Chabad, a neurophysiologist. His goal was to improve movement and function in patients with neurological disorders by simulating the neuromuscular system. Later, two physiotherapists, Margaret Knott and Dorothy Voss, further developed and refined these techniques. They introduced practical treatment methods that made PNF widely applicable in physiotherapy and rehabilitation. Today, PNF is used around the world in neurological rehabilitation, orthopedic physiotherapy, sports rehabilitation, pediatric rehabilitation, and geriatric care. Okay, now let's discuss the fundamental principles of PNF. The first principle is functional diagonal and spiral movement patterns. We should know that our daily activities are rarely straight line movements. When we reach for an object, put on a shirt, throw a ball, or climb stairs, our joints move in multiple planes simultaneously. PNF is designed to mimic these natural movement patterns, making rehabilitation more functional. The second principle is manual resistance. The therapist applies appropriate resistance during movement. This resistance is never excessive. It is adjusted according to the patient's strength and ability. Proper resistance helps improve muscle activation, strength, and motor control. The third principle is the stretch stimulus. A gentle stretch at the beginning of movement activities the muscle spindles, facilitating a stronger and smoother muscle contraction. This is one of the key mechanisms behind PNF. The fourth principle is irradiation, also known as overflow. This means that when stronger muscles contract, the activation can spread to weaker muscles, helping improve overall movement and muscle recruitment. The fifth principle is timing for emphasis. Sometimes one muscle group is weak than other. By controlling the timing and sequence of muscle contractions, the therapist can place greater emphasis on strengthening the weaker muscles without disrupting the overall movement pattern. Another important principle is repetition. Repeated practice of correct movement patterns helps improve coordination, muscle memory, and functional performance. As we often say in rehabilitation, practice leads to better motor learning. Finally, PNF emphasizes motor learning. The goal is not simply to increase muscle strength, but to retrain the nervous system so that patients can perform smooth, coordinated, and efficient functional movements in their daily lives. So, if we summarize this slide, PNF is built on functional movement patterns, appropriate manual resistance, stress stimulation, irradiation, proper timing, repetition, and motor learning. These principles work together to improve strength, coordination, flexibility, and functional independence. Okay. Now that we understand the history and core principles of PNF, let's move to the next slide and explore the neurophysiological basis that explains when these techniques are so effective. Now let's move to the neurophysiological basis of PNF. This is one of the most important concepts in today's workshop because it explains why PNF techniques actually work. You should know that every movement in our body is controlled by continuous communication between the brain, spinal cord, nerves, muscles, and sensory receptors. PNF takes advantage of these communication to improve movement, strength, and coordination. The key sensory receptors involved in PNF are the muscle spindle and the Golgi tendon organs, often called GTOs. Let's start with the muscle spindle. Muscle spindles are located within the muscles. Their main job is to detect changes in muscle length and the speed of stretching. When a muscle is stretched quickly, the muscle spindle sends signal to the spinal cord and brain, causing the muscle to contract. This protective response is known as a stretch reflex. In PNF, therapists Use a gentle and controlled stretch at the beginning of certain movements to activate the muscle spindle. This helps produce a stronger, smoother, and more coordinated muscle contraction. Now let's talk about the Golgi tendon organ or GTO. The GTO is located where the muscle joins the tendon. Its role is to monitor muscle tension. When a muscle contracts strongly or maintains an isometric contraction for several seconds, the GTO becomes activated. It then sends signals that encourage the muscle to relax. This protective mechanism is called autogenic inhibition. This is why techniques such as hold relax and contract relax are effective in improving flexibility. After the contraction, the muscle relaxes more easily, allowing a greater stretch and an increase in range of motion. Another important mechanism is reciprocal inhibition. This means that when one muscle is contracted, the opposite muscle automatically relaxes. For example, when the quadriceps contract, the hamstrings relax. The natural response allows movement to occur more efficiently and is commonly used in PNF to facilitate stretching and coordinated movement. The next mechanism is irradiation, also known as overflow. You should know that when stronger muscles work against appropriate resistance, the nervous system can recruit nearby weaker muscles as well. This helps improve muscle activation and overall movement. Especially in patients with weakness following neurological injuries. Another concept is successive induction. This means that after one muscle group contracts strongly, the opposite muscle group may contract more effectively. Therapists use this principle to improve coordination and movement control during rehabilitation. Finally, PNF promotes better motor unit recruitment. Instead of activating only a small number of muscle fibers, PNF encourages the nervous system to recruit more motor units in a coordinated manner. This results in improved strength, endurance, balance, and functional performance. So, to summarize this slide, PNF works by stimulating the body's natural neurophysiological mechanisms. It activates the muscle spindle, utilizes the Golgi tendon organ, applies reciprocal inhibition, irradiation, successive induction, and enhanced motor unit recruitment to improve movement and function recovery. Okay, now that we understand the science behind PNF, let's move to the next slide where we will discuss the indications and contraindications. When PNF should be used and when it should be avoided. Now let's move to the slide 6 and discuss the indications and contraindications of PNF. Okay, before applying any treatment technique, you should always ask yourself two important questions. When should I use this technique and when should I avoid it? This is an important part of clinical decision making because selecting the right patient is just as important as performing the technique correctly. Let's start with the indications. PNF is recommended for patients who need improvements in strength, flexibility, coordination, balance, and functional movement. One of the most common indications is neurological rehabilitation. For example, patients with stroke often experience muscle weakness, poor coordination, and difficulty performing daily activities. PNF can help improve motor control, movement patterns, and functional independence. It is also beneficial for individuals with Parkinson's disease, where it can improve movement initiation, posture, balance, and gait. Patients with multiple sclerosis may benefit from PNF by improving muscle coordination, stability, and functional mobility while considering their fatigue levels. PNF is also widely used in cerebral palsy, especially in children, to enhance posture coordination and movement control. Now let's move to orthopedic rehabilitation. PNF is useful for patients recovering from sports injuries, ligament injuries, muscle strains, joint stiffness, frozen shoulder, low back pain, and post-operative rehabilitation. For example, after ACL reconstruction or shoulder surgery, PNF techniques can help restore joint mobility, muscle strength, and normal movement patterns as part of a structured rehabilitation program. PNF is also effective for patients with muscle weakness, reduced flexibility, poor balance, or difficulty performing functional tasks such as walking, climbing stairs, or reaching overhead. Athletes also use PNF to improve flexibility, performance, coordination, and injury prevention. Okay, now let's discuss the contraindications. Although PNF is very effective, it is not appropriate for every patient. One contraindication is an acute fracture. Applying resistance or stretching before the bone has healed may delay recovery or cause further injury. Patients with severe osteoporosis should also be treated cautiously because strong resistance or stretching may increase the risk of fractures. PNF should generally be avoided after recent tendons or ligament repair until the surgeon or rehabilitation protocol allows progressive loading. It is also contraindicated in acute inflammation where tissues are swollen, painful, and still healing. If a patient experiences severe pain during movement, treatment should be modified or stopped. Pain is a warning sign and should never be ignored. Patients with unstable joints or joint dislocations should not receive forceful PNF techniques because excessive movement may worsen instability. Another important consideration is uncontrolled hypertension or serious cardiovascular conditions. Some PNF techniques involve strong isometric contractions, which can temporarily increase blood pressure. In these patients, the intensity should be reduced or the technique avoided if necessary. Okay, so you should know that PNF is not a one size fits all treatment. Every patient is different. Okay, it's a clinical tip for you all. Before applying any PNF technique, always perform a thorough assessment, identify the patient's goals, review any contraindications, and select the safest and most appropriate intervention. Remember, effective rehabilitation is not about using every technique, it is about choosing the right technique for the right patient at the right time. Okay. Now that we know when PNF should be used and when it should be avoided, let's move to the next slide and learn about the basic principles of PNF treatment that ensure safe and effective clinical practice. Now let's move to slide 7 and discuss the basic principles of PNF treatment. Okay, now that we know what PNF is and when it should be used, the next question is how do we apply it correctly? We should know that the success of PNF does not depend only on the technique itself. It also depends on how the therapist performs the treatment. Even a very effective technique may produce poor results if their basic principles are not followed. The first principle is proper therapist body mechanics. As physiotherapists, we should maintain a stable posture while treating our patients. Keep your feet shoulder width apart, okay? Bend your knees slightly and use your body weight instead of only your arms. Good body mechanics allow you to apply resistance more effectively while protecting yourself from fatigue and injury. The second principle is correct hand placement. Your hands should be placed firmly but comfortably on the patient's body. Avoid gripping painful areas. Instead, position your hands so they guide the desired movement and provide clear tactical input. Remember, your hands are only providing resistance. Remember, your hands are not only providing resistance, they are also giving sensory feedback to the patient's nervous system. The third principle is appropriate manual resistance. This is one of the most important principles. Resistance should be appropriate, not maximal. If the resistance is too little, the patient will not receive enough stimulation. If the resistance is too much, the patient may lose the correct movement pattern or even experience pain. Always adjust the resistance according to the patient's age, diagnosis, muscle strength, pain level, and functional ability. The fourth principle is verbal commands. Clear communication improves patient performance. Use simple and confident instructions such as pull, push, halt, relax, keep going. These short commands help the patient understand what to do and improve muscle activation. The fifth principle is visual guidance. Whenever possible, encourage the patient to look in the direction of movement. For example, if the arm is moving upward, ask the patient to follow the hand with their eyes. Visual input enhances coordination, balance, and motor learning. The sixth principle is the stretch stimulus. Before initiating certain PNF patterns or a gentle stretch may be applied to the target muscles. This activates the muscle spindle and prepares the muscles for a stronger and smoother contraction. However, the stretch should always be gentle and pain-free. Okay. The seventh principle is traction and approximation. Traction means applying a gentle pulling force along the joint. It is often used for facilitate movement, reduce joint compression, and assist weaker muscles. Approximation means applying gentle compression through the joint. This technique improves joint stability, postural control, and co-contraction of muscles, making it especially useful in weight-bearing activities. The eighth principle is timing. Timing refers to performing muscle contractions in the correct sequence. Sometimes one muscle group is weaker than another. By emphasizing the weaker muscles at the right time, we can improve coordination and achieve smoother functional movement. The ninth principle is smooth and coordinated movement. PNF movement should always be controlled, rhythmic, and functional. Avoid sudden, jerky, or forceful movements. The objective is to help the patient move naturally and efficiently, just as they would during daily activities. So, the clinical tip here is for you. You should know that PNF is much more than applying resistance. It is a combination of correct positioning, therapist body mechanics, manual resistance, verbal cues, visual guidance, stretch, timing, and patient participation. When all these principles are combined, the treatment becomes more effective, safer, and functionally meaningful. Okay, now that we have learned the basic treatment principles, let's move to the next slide and explore the different PNF movement patterns used for the upper and lower limbs. Now let's move to slide 8 and discuss PNF movement patterns. So this is one of the most interesting and important parts of PNF. You should know that PNF does not train muscles individually, it trains movements. This is one of the biggest differences between PNF and many traditional strengthening exercises. In our daily life, we rarely move in a straight line. Think about activities like combing your hair, fastening a seatbelt, reaching for an object on a shelf, walking, kicking a ball, or climbing stairs. These movements involve multiple joints and multiple planes of motion at the same time. That is exactly why PNF uses diagonal and spiral movement patterns. So the upper limb has four basic patterns. We will discuss about upper limb patterns. So the upper limb has four basic patterns: D1 flexion, D1 extension, D2 flexion, and D2 extension. These patterns combine movements at the shoulder, elbow, forearm, wrist, and hand to create functional movement sequences. For example, when bringing your hand toward your mouth to eat or drink, you naturally use a D1 flexion pattern. When reaching up and outward, such as placing an object on a high shelf or drawing a sword, you perform a D2 flexion. So, lower limb patterns. Similarly, the lower limb also has four basic patterns. D1 flexion, D1 extension, D2 flexion, D2 extension. These patterns involve coordinated movements at the hip, knee, ankle, and toes. They closely resemble everyday activities such as walking, changing direction, stepping over obstacles, climbing stairs, running, and maintaining balance. Characteristics of PNF patterns. So now let's understand what makes these patterns unique. First, they are diagonal. Instead of moving only forward or sideways, the limb moves diagonally across the body, which is how most functional activities occur. Second, they are spiral. The movement combines rotation with flexion or extension, making it more natural and efficient. Third, they are multiplanar. Rather than moving in only one plane, these patterns combine movements in the sagittal, frontal, and transverse planes simultaneously. Finally, they are functional. Every PNF pattern is designed to resemble movements that patients perform in everyday life. Why are these patterns important? So the question arises that why are these patterns important? You should know that practicing these movement patterns helps improve muscle strength, coordination, joint mobility, balance, motor control, and functional independence. Instead of strengthening one isolated muscle, PNF trains the entire movement chain, making rehabilitation more practical and meaningful. So, here is the clinical example for you. After a stroke, a patient may have difficulty reaching for a glass of water. Rather than strengthening only the shoulder or elbow separately, we can use PNF upper limb diagonal pattern to retrain the complete reaching movement. Similarly, during great rehabilitation, lower limb PNF patterns help restore coordinated stepping and improve walking ability. Okay, so the clinical tip is here for you that always remember that the goal of PNF is not perfect muscle contraction. It is effective, coordinated, and functional movement. It is an efficient, coordinated, and functional movement. Okay, focus on movement quality rather than force alone. Okay, now that we understand the different PNF movement patterns, let's move to this next slide and study the upper limb patterns in detail, including D1 and D2 flexion and extension with their clinical applications. Now let's move to slide 9 and discuss the upper limb PNF patterns. Now that we understand the basic concepts of PNF movement patterns, let's focus on the upper limb. You should know that the upper limb has four primary PNF patterns: D1 flexion, D1 extension, D2 flexion, and D2 extension. These patterns combine movements of the shoulder, elbow, forearm, wrist, and fingers into coordinated functional activities. Let's start with D1 flexion. D1 flexion is often described as the hand to mouth movement. Imagine you are eating with a spoon, drinking from a cup, brushing your teeth, bringing a mobile phone to your ear. These everyday activities use a movement similar to D1 flexion. In this pattern, the shoulder moves into flexion, adduction, and external rotation, while the forearm usually moves into supination and the wrist and fingers flex to grasp an object. Because this pattern closely resembles daily activities, it is commonly used during functional rehabilitation. Now let's look at D1 extension. D1 extension is simply the reverse of D1 flexion. After bringing your hand to your mouth, you naturally return your arm back to your side. This movement involves shoulder extension, abduction, and internal rotation, helping patients improve controlled lowering and reaching movements. Next is D2 flexion. This is one of the most recognizable PNF patterns and is often called the drawing a sword pattern. Imagine reaching across your body, grasping a sword, and lifting it upward and outward. Another example is reaching for an object on a high shelf, waving to someone, serving to tennis, preparing to throw a ball. In D2 flexion, the shoulder moves into flexion, abduction, and external rotation. This pattern is excellent for improving overhead reaching activities. Now let's discuss D2 extension. D2 extension is the opposite movement. The arm returns diagonally downward across the body into the starting position. This movement helps improve controlled arm lowering and coordination during functional tasks. So, clinical applications. You should all know that these upper limb PNF patterns are widely used in clinical practice. For example, in stroke rehabilitation, they help patients regain coordinated reaching and grasping movements. After rotator cuff injuries or shoulder surgery, these patterns improve shoulder mobility, muscle strength, and functional use of the arm. In sports rehabilitation, they help restore coordinated upper limb movements required for throwing, serving, lifting, and overhead activities. PNF patterns are also useful for patients with shoulder instability, frozen shoulder, muscle weakness, neurological disorders, reduced upper limb coordination. So the clinical tip for you guys is always remember that the objective is smooth, coordinated, and pain-free movement. Do not force the patient through the pattern. Apply appropriate manual resistance. Provide clear verbal commands such as pull, push, open your hand, or reach up, and allow the patient to perform the movement naturally. Encourage the patient to look toward the moving hand as visual guidance can improve coordination and motor learning. Okay, now we have covered the upper limb PNF patterns. In the next slide, we will move on to the lower limb patterns and see how they help improve gait, balance, mobility, and functional activities such as walking and climbing stairs. Now let's move to slide 10 and discuss the lower limb PNF patterns. In the previous slide, we learned about the upper limb patterns. Now we will focus on the lower limb, which plays a major role in walking, balance, standing, climbing stairs, running, and many other functional activities. You should know that just like the upper limb, the lower limb also has four basic PNF patterns: D1 flexion, D1 extension, D2 flexion, and D2 extension. These patterns combine movements of the hip, knee, ankle, and toes to create coordinated functional movements. Let's start with D1 flexion. In D1 flexion, the hip moves into flexion, adduction, and external rotation. The ankle moves toward dorsiflexion and the toes extend. A simple way to remember this pattern is to imagine lifting your foot to cross one leg over the other while sitting or preparing to step onto a stair. This movement is commonly used during walking, stepping over obstacles, dressing such as putting on trousers, crossing the legs while sitting. Okay. Now let's discuss D2 extension. D1 extension. D1 extension is a reverse movement. The hip moves into extension, abduction, and internal rotation, while the foot moves downward into plantar flexion. This pattern is important during the push-off phase of walking, helping propel the body forward and improving stability during standing and gait. Next is D2 flexion. In D2 flexion, the hip performs flexion, abduction, and internal rotation. Think about moving your leg outward while stepping sideways or getting into a car. This pattern is useful for side stepping, improved balance, functional transfers, athletic movements requiring lateral control. Now let's look at D2 extension. D2 extension is the opposite movement. The hip moves into extension, adduction, and external rotation, returning the leg to a neutral or weight-bearing position. This pattern contributes to standing balance, controlled walking, weight shifting, functional mobility. Clinical applications for this is you should know that lower limb PNF patterns are extremely valuable in rehabilitation. For patients recovering from stroke, these patterns help improve walking ability, coordination, and weight transfer. After hip or knee surgery, they assist in restoring muscle strength, joint mobility, and function movement. In patients with balance disorders, PNF improves posture control and stability. Athletes also benefit from these patterns because they enhance agility, coordination, flexibility, and movement efficiency, reducing the risk of injury. Okay, so clinical example regarding this: imagine a patient who has difficulty climbing stairs after knee surgery. Instead of strengthening only the quadriceps, we can use lower limb PNF patterns to train the entire movement sequence needed for stair climbing. Similarly, a patient recovering from a stroke may struggle with walking because several muscles groups are weak and poorly coordinated. PNF helps these muscles work together to a functional pattern, leading to smoother and more efficient gait. So the clinical tip here, always remember that the objective is not simply to move the leg, but to restore coordinated function movement. Apply appropriate manual resistance. Give clear verbal cues such as lifting your leg, push down, step forward, or keep the movement smooth. And encourage the patient to move through the full pattern without pain. Always monitor the patient's balance, posture, and level of fatigue, especially during standing or weight bearing exercises. Okay, now that we have understood both the upper and lower limb PNF patterns, let's move to the next slide and learn about one of the most commonly used applications of PNF, the stretching techniques, including hold relax, contract relax, and hold relax with agonist contraction. Now let's move to slide 11 and discuss one of the most popular applications of PNF, the PNF stretching techniques. Whenever people hear about PNF, the first thing that usually comes to mind is stretching. While PNF is much more than a stretching method, these techniques are among the most effective ways to improve flexibility and range of motion. You should know that PNF stretching works by using the body's natural neurophysiological mechanisms. particularly the Golgi tendon, organ, and muscle spindle, to help muscles relax and achieve a greater stretch. Today we will discuss the three most commonly used PNF stretching techniques. First is hold relax technique. Let's start with the hold relax technique. In this technique, the target muscle is first placed in a comfortable stretch until mild resistance is felt. The patient then performs an isometric contraction, meaning the muscle contracts without producing any joint movement. The contraction is usually held to 5 to 10 seconds. Okay. After that, the patient relaxes completely and the therapist gently stretches the muscle further. Because of autogenic inhibition, the muscle relaxes more effectively, allowing an increase in range of motion. This technique is especially useful for patients with muscle tightness, reduced flexibility, or joint stiffness. Contract relax technique. Next technique is contact relax. Okay, unlike hold relax, this technique uses an isotonic contraction where the muscle actually moves while contracting against resistance. After the contraction, the patient relaxes and the therapist applies a gentle passive stretch. This technique is commonly used when there is a limitation in joint mobility caused by muscle tightness. The third technique is hold relax with agonist contraction. This begins the same way as hold relax. The patient performs an isometric contraction of the tight muscle for several seconds. After relaxing, instead of relying only on the therapist, the patient actively contracts the opposite muscle group called the agonist. This uses the principle of reciprocal inhibition, helping the tight muscle relax even further and allowing a greater increase in flexibility. This technique is considered one of the most effective methods for improving range of motion. So the benefits of PNF stretching. You should know that research has shown PNF stretching can provide several important benefits. It helps to increase flexibility, improve range of motion, reduce muscle tightness, enhance functional movement, improve athletic performance, reduce the risk of muscle injuries, and prepare muscles before rehabilitation exercises or sports activities. Okay. So these stretching techniques are commonly used in the patients with hamstring tightness, calf muscle tightness, frozen shoulder, neck muscle stiffness, low back pain, sports injuries, and post-operative rehabilitation when appropriate. These are the clinical applications of stretching techniques. Okay. So the clinical tip you should know that always remember that PNF stretching should never be painful. Okay. Ask the patient to contract only to a comfortable level, usually about 50 to 70% of their maximum effort. Okay. Avoid asking for maximal contractions. Okay, especially in elderly patients or those with acute pain. Okay. Stretch the muscle slowly and gently after relaxation, and always monitor the patient's comfort throughout the procedure. Okay. Also remember that proper patient positioning, clear verbal commands, and good communication are essential for achieving the best results. Okay. Now we have learned the most commonly used PNF stretching techniques. In the next slide, we will move on to PNF strengthening techniques and understand how they help improve muscle strength, stability, coordination, and functional performance. Now let's move to slide 12 and discuss PNF strengthening techniques. So far, we have learned about PNF stretching techniques, but you should know that PNF is not only used to increase flexibility, it is also a highly effective method for improving muscle strength, coordination, endurance, and functional movement. Unlike traditional strengthening exercises that often target a single muscle, PNF strengthening techniques train groups of muscles to work together in functional movement patterns. Okay. Let's discuss the most commonly used strengthening techniques. First is rhythmic initiation. Okay, this technique is mainly used for patients who have difficulty starting a movement, such as individuals recovering from a stroke or those with Parkinson's disease. Okay, This movement is performed in 4 stages. First, the therapist moves the patient passively. Next, the patient helps with the movement using active assisted movement. Okay. Then the patient performs the movement actively. Finally, the patient performs the movement against gentle resistance. Okay. This gradual progression helps improve movement awareness, coordination, and motor learning. Okay. Now let's discuss about slow reversal. In this technique, the patient performs alternating movements between agonist and antagonist muscles without stopping. For example, the patient performs flexion followed immediately by extension while the therapist provides appropriate resistance. This technique improves muscle strength, coordination, controlled movement, and functional mobility. So, the next technique is rhythmic stabilization. Here, the therapist applies resistance in different directions while the patient tries to hold the position without allowing movement. This creates a contraction of opposing muscle groups. Okay, rhythmic stabilization is particularly useful for improving joint stability, posture control, core stability, and shoulder and trunk stability. Okay, it is commonly used after joint injuries and during balanced rehabilitation. Okay, another important technique is repeated contractions. In this method, resistance is repeatedly applied throughout the movement whenever muscle weakness is noticed. The goal is to facilitate stronger muscle activation and improve endurance. This technique is especially helpful for patients with muscle weakness following neurological or orthopedic conditions. So, clinical applications, you should know that these strengthening techniques are widely used in clinical practice. They are beneficial for patients with stroke, Parkinson's disease, multiple sclerosis, sports injuries, post-operative rehabilitation, muscle weakness, shoulder instability, balance disorders. Okay, they are also effective for improving gait, posture, and functional activities such as reaching, lifting, standing, and walking. Okay, so the clinical tip, you always remember that the quality of movement is more important than the amount of resistance. Use only the amount of resistance that allows the patient to perform the movement smoothly and correctly. Okay, give simple verbal commands such as you can say push, pull, hold, keep going, relax. Okay, observe the patient's posture, breathing, and level of fatigue without the treatment. Okay, if the patient experiences pain or losses proper movement control, reduce the resistance or stop the technique. Okay, so to summarize this slide, PNF strengthening techniques helps improve muscle strength, stability, coordination, endurance, and functional movement by training the nervous system and muscles to work together efficiently. Okay, now that we have learned both stretching and strengthening techniques, let's move to the next slide and discuss the clinical applications of PNF in neurological, musculoskeletal, sports, and post-operative rehabilitation. Okay. So now let's move to slide 13 and discuss the clinical applications of PNF. Okay. So far we have learned the principles, movement patterns, stretching techniques, and strengthening techniques of PNF. Now the important question is, where can we actually use PNF in clinical practice? So you should know that PNF is one of the most versatile rehabilitation approaches because it can be applied to patients of different ages and in a wide variety of clinical conditions. Okay, let's discuss some of the most common applications. One of the biggest areas where PNF is used is neurological rehabilitation. Okay, patients with conditions such as stroke, Parkinson's disease, multiple sclerosis, traumatic brain injury, spinal cord injury, and cerebral palsy often have muscle weakness, impaired coordination, poor balance, and difficulty performing functional movements. Okay, PNF helps improve motor control, muscle activation, coordination, balance, gait, functional independence. Okay, for example, after a stroke, PNF can help retrain reaching, standing, transferring, and walking by using functional movement patterns. Okay, PNF is also widely used in musculoskeletal conditions. Okay, patients with frozen shoulder, low back pain, neck pain, muscle tightness, ligament injuries, tendon injuries, and joint stiffness. Okay, can benefit from PNF techniques. Okay, these techniques help improve joint stability, muscle strength, flexibility, functional movement, pain-free movement, and patterns. Okay, So third is sports rehabilitation. Athletes frequently use PNF during rehabilitation and performance training. Okay, it helps to increase flexibility, improve strength, enhance coordination, improve movement efficiency, and reduce the risk of injury. Okay, so the PNF is also used for hamstrings, quadriceps, hip flexors, calf muscles, and shoulder muscles before returning to sports. Okay, so fourth is post-operative rehabilitation. Okay, PNF is also beneficial after orthopedic surgeries such as could be ACL reconstruction, total knee replacement, hip replacement, rotator cuff repair, shoulder stabilization procedures. Okay, once the surgeon allows progressive rehabilitation, PNF can safely help restore joint mobility, muscle strength, balance, functional activities, and walking ability. Okay, so the fifth is geriatric rehabilitation. Older adults often experience reduced strength, poor balance, and decreased mobility. PNF techniques help improve postural control, walking, balance, functional independence, confidence during daily activities. This may also help reduce the risk of falls. Okay. In pediatric physiotherapy, selected PNF techniques can be used for children with neurological and developmental conditions, okay, to improve posture, movement control, and functional abilities. Treatment should always be individualized according to the child's need and tolerance, okay. So the clinical example you should know here that let's take a simple example here, okay. Imagine a patient who has difficulty standing up and he has very difficulty in standing up from a chair after knee surgery, okay. Instead of strengthening only one muscle, we can use PNF movement patterns to train the entire functional activity, okay, including trunk control, hip movement, knee extension, and balance, okay. This makes rehabilitation more practical because we are training the movement the patient actually needs in daily life. Okay, you should know that PNF should always be integrated into a complete rehabilitation program. It is not a standalone treatment, okay. Always begin with a thorough assessment, identify the patient's functional goals, choose the appropriate PNF technique, monitor the patient's response, and gradually progress the exercises as strength and coordination improve. Okay, remember, our ultimate goal is not just stronger muscles, it is better movement, greater independence, and an improved quality of life. Okay, now that we have explored the clinical applications of PNF, let's move to our next slide where we will discuss safety precautions, common mistakes, and important clinical tips for applying PNF effectively in practice. Now let's move to slide 14 and discuss the evidence, advantages, and limitations of PNF. We have covered the principles, techniques, and clinical applications of PNF. Before we conclude, it's important to understand what research says about PNF, why it is beneficial, and what its limitations are. As healthcare professionals, we should always aim to provide evidence-based practice, which means combining the best available scientific evidence with our clinical experience and the patient's individual needs. Evidence supporting PNF. You should know that many research studies have shown positive effects of PNF when it is applied correctly. According to the available evidence, PNF can help improve range of motion, muscle strength, flexibility, balance, coordination, gait and walking ability, functional mobility, and overall physical performance. Okay, research also suggests that PNF stretching may produce greater improvements in flexibility than conventional static stretching in certain populations, particularly when incorporated into a structured rehabilitation program. Okay. However, the best outcomes are achieved when PNF is combined with other physiotherapy interventions such as the therapeutic exercises, balance training, functional training, and patient education. Okay. So let's discuss the advantages of PNF. One of the biggest advantage is that PNF focuses on functional movement rather than isolated muscle training. Okay, this makes it highly relevant to daily activities such as walking, reaching, lifting, and climbing stairs. Okay, another important advantage is that PNF can improve multiple components at the same time, including strength, flexibility, coordination, balance, and neuromuscular control. Okay, it is also a versatile approach because it can be used in neurological rehabilitation, orthopedic, sports, pediatric, and post-operative rehabilitation as well. Okay, another important benefit is that PNF encourages active patient participation, which enhances motor learning and helps patients become more engaged in the rehabilitation process. Okay, now let's discuss the limitations. Although PNF is an excellent treatment approach, it is not suitable for every patient or every clinical situation. Okay, one limitation is that it requires proper training and clinical skills from the therapist. Without correct hand placement, body mechanics, timing, and resistance, the technique may not produce the desired results. Okay, another limitation is the PNF can be time consuming, especially when compared with simple stretching techniques. When compared with the simple stretching exercises, okay, it also depends on patient cooperation. Patients need to understand instructions and actively participate in the treatment. For individuals with severe pain, cognitive impairment, or poor communication, some PNF techniques may be difficult to perform. Okay, finally, remember that PNF has contraindications such as acute fractures, severe inflammation, unstable joints, and certain post-surgical conditions where resistance or stretching is not yet appropriate. Okay, so the clinical tip you should know that PNF should never replace a comprehensive physiotherapy assessment. Okay, always assess your patient first, identify the problem, set clear rehabilitation goals, and then decide whether PNF is the most appropriate intervention or not. Remember, the right technique for the right patient at the right time is the key to successful rehabilitation. Okay, so to summarize this slide, PNF is an evidence-based rehabilitation approach. Secondly, it improves strength, flexibility, balance, coordination, and functional mobility. Thirdly, it offers many clinical advantages when used appropriately. Fourthly, like any treatment, it has limitations and should always be applied based on clinical reasoning and patient assessment. Okay, we have almost reached the end of today's workshop. In the next and final slide, we will summarize the key points we have learned and conclude our session with some important take-home messages. Okay, so now we have reached the final slide of today's workshop. First of all, I would like to thank each and every one of you for joining this PMC certified workshop on Proprioceptive Neuromuscular Facilitation PNF techniques. I hope this session has helped you build a clear understanding of both the theoretical concepts and the practical clinical applications of PNF. So, okay, before we end, let's quickly summarize what we have learned today. What we have learned, okay. We started by understanding what PNF is and learned that it stands for Proprioceptive Neuromuscular Facilitation. We discussed that PNF is much more than a stretching technique. It's a comprehensive rehabilitation approach designed to improve strength, flexibility, coordination, balance, neuromuscular control, and functional movement. Next, we explored the history of PNF and learned about the contributions of Dr. Herman Kabad along with Margaret Knott and Dorothy Voss, who helped develop and apply these techniques in physiotherapy. When then we have discussed the neurophysiological basis of PNF and understood the important roles of the muscle spindle, Golgi, tendon, organ, stretch reflex, autogenic inhibition, and reciprocal inhibition, and irradiation in improving muscle performance and movement. Okay, after that we have reviewed the indications and contraindications, emphasizing that proper patient assessment and clinical reasoning are essential before applying any PNF technique. We have also learned about the basic principles of PNF treatment, including therapist body mechanics, manual resistance, verbal commands, visual guidance, timing, traction, approximation, and smooth function movement. Then we explored the upper limb and lower limb diagonal movement patterns, understanding how they closely resemble everyday functional activities. We discussed the PNF stretching techniques, including hold relax, contract relax, and hold relax with agonist contraction, and saw how these techniques help improve flexibility and joint range of motion. Okay, we have also covered PNF strengthening techniques and such as rhythmic initiation, slow reversal, rhythmic stabilization, and repeated contractions, which are widely used to improve muscle strength, stability, coordination, and motor control. Finally, we looked at the clinical applications, evidence, advantages, and limitations of PNF and understood why it remains one of the most important and valuable treatment approaches in modern physiotherapy rehabilitation. Okay, so you should remember these important points. These are the take-home messages we have discussed in the slide 14. So in last time we have some take-away messages. First is that always perform a thorough patient assessment before selecting any PNF technique. Secondly, choose the technique based on the patient's condition, goals, and stage of rehabilitation. Thirdly, focus on quality of movement rather than applying excessive resistance. Fourthly, use clear communication, proper therapist body mechanics, and evidence-based clinical reasoning. Fifth and the last is remember that PNF works best when integrated with a comprehensive rehabilitation program rather than used in isolation. Okay, as physiotherapists, our responsibility is not just to improve muscle strength or flexibility. Our ultimate goal is to restore meaningful functional movement that allows patients to return to their daily activities with greater independence and confidence. Okay, I encourage all of you to continue practicing these techniques under proper supervision. Keep updating your knowledge through current research and always apply PNF safely and ethically in your clinical practice. Once again, thank you for your participation, your time, and your dedication to learning. If you have any questions or you would like to discuss any clinical scenarios related to PNF, you are welcome. I will be happy to answer them now. Thank you, everyone. Stay committed to learning, keep improving your clinical skills, and remember the PMC motto that learn, heal, and grow. Have a wonderful day ahead. Okay. If you have any questions, you can comment in the comment section, and after the session ended, you can DM me for your certification link. Okay. Thank you and Allah Hafiz.